patient today is an otherwise healthy 22-year-old who presents for a non-surgical extraction of tooth number 30. We want to make sure to relieve his pain and improve his function today. I previously saw this patient on a different consultation, and so today I would like to check his vital signs to make sure that he is able to have his extraction today. Looking into his general health history on Axiom, we can tell that his blood pressure is 120/80, the pulse is 60, respiratory rate 10, and the temperature is 98.6 degrees. These are all within normal limits, and so this will classify him as ASA class 1, and so we can perform the procedure today at NYUCD. Hello Yaki, I'm your student doctor today. I'm going to be treating you at NYUCD. Just wanted to talk to you about some of the concerns you may be having.
Okay.
Is this your first extraction that you've had?
Yeah.
You've never had an extraction before?
No.
How does that make you feel?
A little bit concerned.
A little bit concerned?
Yeah.
That's normal to be concerned and to have a little bit of anxiety, but I just want to make sure that you know that we are here to alleviate your pain and to help walk you through your anxiety.
Okay.
Would you like me to go over some of the aspects of the procedure that we're doing today?
Yes, please.
Of course. So there's going to be some swelling and bleeding on the side of your face, maybe even both sides. There's trismus sometimes is a big factor and the biggest concern of many patients. The swelling may last for 2 to 3 days, but the bleeding must stop on the day of the extraction. And if it doesn't, then please contact our emergency phone number that we are going to provide you with at the end of the procedure. If you are in a lot of pain, we can prescribe you some over-the-counter medications that will help alleviate your pain. As well as, we don't foresee any complications today because you are an otherwise healthy patient. So now that we have discussed what to expect and some of the risks, I would like for you to please sign this consent form in order for me to begin this procedure.
Okay.
Thank you very much. Before we begin any procedure, it is important to have our proper PPE, and that is we have to have our yellow gown, our mask. For the purposes of this video, we will not be wearing the masks, but it's masks, eyewear, I have my own eyewear, and gloves. The extraction, we must make sure that our patient is properly anesthetized. Because we are extracting tooth number 30, that is the lower right first molar, and we will need to perform the inferior alveolar nerve block and the long buccal nerve block. In order to check that the patient is properly anesthetized, we will put pressure here on the lower lip. Do you feel this?
No.
That would mean that the patient is properly anesthetized. We can also use endo ice on the tooth in order to see if the patient has a reaction.
Before starting any procedures on my patient Elena today, you have to make sure that you're wearing the proper PPE, which is the gown. We would put on a mask, but I'm not wearing it for speaking purposes, goggles, and gloves. And now we will discuss the armamentarium for a non-surgical extraction. So this is the armamentarium that you would do for a non-surgical extraction. This is a Minnesota retractor that you would use to retract the cheek for better visibility. These are elevators. You have a small one and a wide one to elevate the tooth. You have a periosteal elevator, which you would use to release the soft tissues and the PDL ligaments around the tooth. You have a double-ended curette, which you would use to debris the socket after extraction of the tooth of any granulation tissue and dental debris. You have a monojet syringe filled with saline, so you would irrigate the socket after the extraction. You have a 4x4 gauze that you would use open for a throat screen to prevent any aspiration of dental material or of any debris while the tooth is being extracted. And then you would also use a folded piece for pressure homeostasis to prevent excessive bleeding. You would also have a bite block to support the jaw so the patient can keep their mouth open and to relieve the pressure of the contralateral temporomandibular joint. And then of course you have the forceps that would you use to luxate the tooth. In this particular instance, since it's tooth number 30, which is the lower right first molar, we are going to use the mandibular universal forceps, also known as a 151. For a non-surgical extraction, you want the patient seated, and for a lower molar extraction, you want the patient slightly inclined, about 30 degrees, which is a semi-supine position. This makes the patient most comfortable and reduces the incidence of fainting or vasovagal syncope. Also, the doctor should have their arm incline downward at about a 120-degree angle. This is the most comfortable position for this type of extraction. For this particular extraction, there are some anatomical landmarks that we should be aware of. So one of them that you want to look out for is the inferior alveolar nerve, and you want to make sure that it's not in the area of the tooth that's going to be extracted. And you do this to pre-op radiographs. So in this case, we are not concerned about the inferior alveolar nerve. It is okay and it is safe to do this extraction. We will now continue with the procedure. Since I am left-handed and we are working on the patient's right side, I will stand to the patient's left. So the first thing that we would do is ask the patient to open their mouth. We will use a bite block on the contralateral side of the side that we're working on and have the flat part against the cheek. This will relieve the pressure on the contralateral temporomandibular joint and help keep the patient's mouth open. Next, we will open a 4x4 gauze and use it as a throat screen. This will prevent any aspiration of any materials or dental debris while the extraction is taking place. You will also use a Minnesota retractor against the side where you're working for better visibility. Next, we will use a periosteal elevator with a finger rest, holding it in a pen grasp and using the sharp end, go around the tooth 360 degrees to release the PDL fibers. Next, we will use a small straight elevator, holding the handle in the ball of my hand using a finger rest. It has a cupped serrated edge and you want that side against the tooth that you're working on. So you put the cupped side on the mesial aspect of the tooth, then you turn it clockwise against resistance. Then you do the same thing on the other side with the cupped side against the tooth on the distal, and then you turn it counterclockwise against resistance. This help expands the buccal and lingual plates. Once you do not feel resistance, you switch to a wide straight elevator. Holding it in the same way in the ball of your hand with a finger rest, you do the same thing on the mesial side and on the buccal side against resistance. Next, we will use the mandibular forceps. These are the universal ones, also known as 151. You will hold the handles in your hand with a firm grip on the end. Place the beaks on the buccal and lingual aspect of the tooth as far apically as possible. Once you get it down as far apically, in a figure 8 motion, you want to luxate the tooth. Once the tooth is luxated, you want to observe it in the direction of the, when you luxate the tooth, it's going to be the direction of the buccal side, and you want to orient it in the way it was in the mouth and look at the apices. Since this is a lower first molar, it's going to have 2 roots, and you want to make sure the apices are there and not remained in the mandible. Once you have determined that, you will then take a double-ended curette and remove any granulation tissue or any dental debris from the socket, because this can exacerbate any bleeding. So you want to make sure it's as clean as possible. Once you do that, you take a monojet syringe filled with saline and you irrigate the socket. Lastly, you will take out the bite block and place a folded 4x4 piece gauze on the socket and ask the patient to bite down for 20 minutes. And this is going to give hemostatic pressure to stop any bleeding. We have now completed a non-surgical extraction of the lower right first molar, which is tooth number 30. And now we will ask the patient if they're okay. Are you okay? How are you feeling?
I'm good.
Good. So now we will proceed on to any post-operative management.
Since this is a non-surgical extraction, I'm not gonna prescribe patient any antibiotic, and also patient is very healthy. So I'm not gonna using any prescription for pain management. So I suggest patient to use over-counter pain medication like ibuprofen. If patient have any contraindication for ibuprofen, I'm gonna suggest her to use Tylenol, which is a better choice. So if the bleeding is supposed to stop by tonight, and definitely expect some swelling within a couple days. And normally the swelling will end within a week or so. And if the bleeding now stop after you apply the gauze for 20 minutes, just fold the gauze like what I did before, and do that again. Complete 3 cycles. If the blood did not stop, you still concerned, please call us as soon as possible with the number I'm gonna provide you later, and the number gonna be 212-998-9660. But I'm also gonna give you a workout document which have everything I said within writing. After the extraction, so you're gonna feel like numbness for about 6 to 4 hours. That's really normal for the local anesthesia. And also, local anesthesia contain epinephrine, which is like tourniquet for the blood. Like when we do the procedure, we don't want too much blood coming out, right? But once the medicine wear off, the blood gonna come out. That may give you some like actual bleeding, so don't be scared. Just do what I said, like roll the gauze again, apply the 20 minutes rule, and if you do that 3 times, if you're still concerned and really worried about, please call us with the emergency number. And I also gonna give my own contact number at the very end as you walk out. So I suggest you to drink without any straws, and do not spit, and also do not rinse, because they're gonna irritate the clot, and they're gonna delay the healing. And for food choice, I really suggest you to eat anything cold, like ice shake or milkshake or ice cream, and do not eat anything hot and spicy. And also, please do not eat anything too hard and chewy. So soft food like Jello, that can be a better choice for you. Okay. So do you have any questions? No? And here's the workout form which I just mentioned before. And also, if you feel any really concerned about your situation, and you feel any situation going worse, please call us as soon as possible. And I would like to see you within a week to see how the wound healing situation, how you recovery. And I would like to have you schedule an appointment while you work out, and or you can just call us with the number I listed right here. Okay? All right, good.